How is carcinogenesis in the colon diagnosed? Have you ever wondered how doctors identify cancer in the colon? Carcinogenesis in the colon is the process where normal cells change into cancer cells. Diagnosing this condition is crucial for effective treatment. The process involves several steps, starting with screening methods. For adults, screenings usually begin at age 45. If someone has a family history of colon cancer or other risk factors, they may need to start earlier. Common screening tools include stool-based tests and direct visualization techniques. Stool tests are designed to check for hidden blood or abnormal DNA in the stool. These can indicate the presence of cancer or precancerous polyps. The fecal immunochemical test and fecal occult blood test are two examples that detect blood. Newer stool DNA tests look for genetic changes linked to colon cancer. These tests are non-invasive and can often be done at home. However, if the results are positive, further evaluation is necessary. The gold standard for diagnosing colon cancer is a colonoscopy. During this procedure, a thin, flexible tube with a camera is inserted into the colon. This allows doctors to visually inspect the lining for any polyps or tumors. If any suspicious areas are found, small tissue samples, known as biopsies, can be taken for laboratory analysis. This step is vital as it confirms the presence of cancer cells and helps determine their characteristics. If cancer is detected, imaging tests like CORT scans or magnetic resonance imaging may be used to see how far the cancer has spread. Understanding the extent of the disease is essential for planning treatment. Recent advancements have introduced liquid biopsy techniques. These analyze blood samples for cancer-related genetic material. They can detect specific changes in DNA or RNA released by tumors into the bloodstream. For instance, new RNA-based liquid biopsies have shown high accuracy in identifying early-stage colon cancer by measuring chemical modifications in RNA. This method is promising for early detection, especially since it can identify cancer when tumor DNA levels in the blood are very low. Another important aspect of colon cancer diagnosis is microsatellite instability, or MSI. This refers to changes in certain DNA sequences and is assessed using specialized genetic tests. Knowing the MSI status is important for determining prognosis and guiding treatment options, especially for immunotherapy. In summary, diagnosing carcinogenesis in the colon involves a stepwise approach. It starts with initial screening through stool tests or colonoscopy, followed by confirmation through biopsy and tissue analysis. Additional blood or genetic tests may be used for further characterization. New technologies, such as liquid biopsies and advanced genetic panels, are enhancing the accuracy and speed of diagnosis. While these emerging technologies are promising, established screening and diagnostic methods remain as essential. It is crucial for individuals to consult healthcare professionals to determine the best screening and diagnostic strategy based on their personal risk factors and medical history. Early detection through regular screening is the most effective way to prevent colon cancer or catch it at a treatable stage.